Just a short comment on ultrasound, because the most commonly awarded lawsuit in breast cancer is failure to diagnose breast cancer. It's usually in a young woman who has a very dense breast mammographically. She feels a lump, the provider gets a mammogram, it just looks all dense and white and they don't see anything and they say your mammogram looks fine. They need to get an ultrasound. If there's a palpable mass, you need to get an ultrasound. It's going to show you if a lesion is fluid versus solid. It may show you a lesion in a breast where you can't see it mammographically. Also gives you an idea of size. Okay, so what are the ultrasound features of malignancy? Something that is hypoechoic. You see this is darker than the surrounding tissue. It's kind of irregular on the edges here. It has this dark shadow behind it. We call that posterior acoustic shadowing because the sound waves are more likely to bounce up and reflect than have through transmission. And cancers are usually what we call taller than wide. Most breast tissue, when you put a transducer on it, will flatten out and compress, but a tumor is firm and won't compress and flatten like that. So they tend to be taller than wide. This is another example of a cancer. This one looks a little more well circumscribed, but it's still not a completely round circle. There's irregularity here around the edges. Not nearly as much posterior acoustic shadowing on this. So again, there are general findings. It's not like every tumor is going to look the same. Here's another one. This one is much more subtle. It's not very hypoechoic compared to the surrounding tissue, but still a little bit, and it certainly has an irregular pattern there.